All right, so today our speaker is former Wausau West student, Morgan Day, and I'll let her take over and go through her presentation.
All right, so like Mr. Kostrowski said, I am a former West grad, was about in your shoes about 10-ish years ago, and now I'm a chiropractor in Wausau. So before we get started, just by a raise of hands, how many of you have known someone or personally been to a chiropractor? Wow, more than what I thought. Okay. I do want this to try to be interactive, so I'm here to help you guys out. So I do have an outline. We can go off of that, or if you guys have questions or you want to learn more, we can just kind of go off the fly. It's whatever you guys want. But I do want it to be interactive. So anytime I ask a question, and you guys give me an answer, or if you ask a question, I'm going to have Liz, my little helper, pass out some candy, because who doesn't want candy at 1 o'clock in the afternoon? So, next question, who wants to tell me what chiropractors are known for? Realigning joints, or the popping, cracking, that kind of thing. So, good job. So yes, we are known for manual therapy, our joint manipulations, adjustments, a lot of cracking, popping, that kind of thing. What I do want to tell you is there's a huge misnomer on what the pop actually is. A lot of people think, go ahead, you have a question?
No, I was going to say what it was.
Oh, so the popping and cracking that you hear is actually gas being released from the joint. So bones are not moving past each other or actually being realigned. It's more restoring motion to the joint, and the pop that you hear is the gas being released. So that is kind of a misnomer of way back when chiropractic started. So before we get started, if no one has any more questions, I'm just going to do... Oh, over here. Okay. Just kind of wanted to do like a little background on healthcare. So healthcare has a huge spectrum of providers. You have your mainstream or your Western or your conventional medicine, which is your MDs, your DOs, your pharmaceuticals, your drug companies, your surgeries, your radiation. That is mainstream medicine. However, you also have non-traditional care, or your complementary, your alternative, and that's what us chiropractors are. Most complementary or alternative care has more of a holistic approach. What that means is we like to look at the body as a whole system rather than its parts. So for example, when people come to me with headaches, not only do I look at their head and neck, I look at their upper back, I look at their shoulders, I look what they're doing all day. Are they sitting in a desk? Do they have a lot of tension in their lives? What are they eating? I look at everything, and that's kind of our approach. Other non-traditional healthcare is your acupuncturist, your massage therapy, you have homeopaths, naturopaths, there's quite a few. Any questions with that? Question for you guys. Who wants to take a guess when the first chiropractic adjustment was documented? Someone can just throw out a number. Go ahead.
1860.
1860. Okay, anybody else want to give it a shot? 1800. One more. Who wants to take a guess?
I'm really thinking of my job.
Go for it.
1734.
1734. So the correct answer is actually 1895. So chiropractic in general.
Did anybody else go? Okay, we're good.
That's good. So 1895. So relatively, chiropractic is actually very new or young considering healthcare. Western medicine actually dated back for its first true of what it is today is probably like the early 18th century, so like the 1700s. So chiropractic is about 200 years newer than mainstream medicine. So just quick fun fact. Sure you guys are all wondering. Before I get into it, who wants to take a guess on how many years it took me to become a chiropractor outside of high school? Hand down. Who wants to take a guess? Go for it. 4 years out after high school? 7? Right on. You can get 2. So
I was going to say that.
In general, it takes at least 7 to 8 years after high school to earn a degree in chiropractic. So the most typical route is usually an undergrad, somewhere in the sciences. So your biology, chemistry, biochemistry, kinesiology or exercise science. You also have some psychology majors in there as well. And then after that, you have acceptance and then completion of a doctorate degree at an accredited chiropractic college. For me, it took me about 7 years. I actually went to UW Stevens Point and UW La Crosse, had a undergrad in biomed, then went to St. Louis University at Logan. Let's see. Any questions with that so far? Nothing? Okay. Next. So, what does it really mean to be a chiropractor? So, a lot of people think all we do is sit and adjust people all day long. However, there is a little bit more to that. As a chiropractor, because we have a doctorate, we are treated as a primary care physician. So that means when people come to us, that we have to be able to distinguish and evaluate them and say, okay, is this urgent, emergent, or routine? If it's routine, is it within our scope? Is this something I can handle as a practitioner, or is this something better suited elsewhere? Because of that, we have education in every organ system and how it could pertain to the musculoskeletal system, because that's what we are. We are musculoskeletal experts. So most people don't realize how much education we have. I'm not a huge fan of this comparison chart just because it's very deceiving, but people don't realize when you look at the total hours that we do have a lot of hours of education, mainly because we have to have a general knowledge of all the organ systems, so we can rule in and rule out what we can treat. What this chart doesn't show you is our hours of education are very different. And med school, if you do any sort of specialty, that is skyrocketed compared to that. So, I'm not a huge fan of the chart, kind of deceiving, but shows we do have a lot of education under our belt and just take a lot of time. Any questions with that? Go for it.
You don't have to go to medical school.
We don't have to. So it's a completely different branch, just like PT schools. PT is now you get a doctorate because they do same thing. They're a primary care provider. You don't need a referral to go to them. It's the same thing. So it's just a different branch. Same thing with optometry, eye doctors, dental. It's kind of the same realm. Great question. Any other questions?
You missed your throw too.
I actually made it work.
We need to perfect this by the end of the
I'm gonna
class.
say, we need this side of the room to talk up a little bit. This side's doing not too bad. Okay, next on the list. So kind of give you a little background, my education, but what do I really do? What is in our scope? Like I said, I am a musculoskeletal expert. Our scope of practice, especially in Wisconsin, is treating musculoskeletal conditions with joint manipulation or manual therapy as our primary means of intervention. So let's talk a little bit more about my day-to-day activity, because that's fun. So I am actually a recent grad, so I graduated last August, and I work at Rupal Chiropractic. My personal philosophy of what I do is more of, my goal is to reduce pain, improve function, and restore better health and wellness by not only restoring mobility, by improving getting patients to be active in their care, and providing a little feedback to the nervous system. I think of myself as a great problem solver. So when people come to me, 9 times out of 10, they're in pain. And a good majority of those are typically, I'm their last resort. So, which is fine, I like a challenge. We aren't mainstream medicine, so I'm not going to be their first thought, which is fine. But it's what I do, and it's something different every day. For example, I have some fun examples to show. I had a hamstring case come in a couple months ago, and he was dealing with chronic hamstring tightness. Just pulled his hamstring severely a couple of years ago, and he was sitting out in track, sitting out in football, came to senior year, didn't want to sit down anymore. So coach recommended him to come in, came in, took a look at him, and hamstring flexibility, fine. It was actually pretty dang good. Not the best I've ever seen, but definitely not the worst. Not what I was expecting, having chronic hamstring pulls and tightness year after year. However, when we looked at the system as an approach, found out his hips and his ankle mobility were crazy locked up. So did a lot of soft tissue, did some joint manipulation, and he had very minimal hamstring tightness as a result, which was great. So that's kind of fun cases that it's a challenge. He's been to PT, he's been to orthopedics, he's done that route, he has stretched on his own, and he came to me. So it's just kind of fun.
I read an article not too long ago about that hip issue. What do you guys do for 6-7 hours a day during the school year? Alright, so everything's shortening up and it just causes that lack of range of mobility. And then what we expect you to do it right after school if you're involved in an extracurricular activity. Get out and try to go to perform, and that's part of it is we don't do enough
In class.
in the class time or the sitting all day, and then you have to try to go and perform. And if your team doesn't warm you up properly, it leads to all these little nagging injuries.
Yes. And unfortunately, even the older you get, work, college, you sit even more. So it just accumulates over and over again. And especially, because Trusty hit it on the head, warming up. I know I was in high school. I didn't really enjoy warm-ups all that much as well. Kind of joked around, slacked off, and it hurt me. I probably wasn't the best athlete I could have been, or I had more injuries than what I could have had. So take warm-up seriously, stretch. It does a ton. Make sure, I know the research is really heading in dynamic warm-ups over static warm-ups. So really emphasize dynamic warm-ups, getting the blood pumping, just because you're supposed to warm up how our muscles are used during a game, not just statically, because sometimes you can overstretch, which causes a reflex within the muscle to tighten back up, which is going to lead to injury. So that's why dynamic warm-ups and moving in the blood flow and stretching how you're going to be acting in a game is better than just standing here, touching my toes, that kind of thing. Make sense? Yeah.
Have you ever caused like damage from doing chiropractic adjustments?
I wouldn't say I've ever caused damage. Have I caused pain? Yes.
Yes.
Are there risks to having those types of...
There are, and that is part of our education. You, as a practitioner, should be able to rule in and rule out whether an adjustment or whatever treatment I feel necessary is right for that patient. So I see from this high to this high. The way I adjust you or treat you is way different than I would treat your grandma or your grandpa. So that's usually as a practitioner we have to decide. They're usually have to be very good about it, but definitely there are some risks. You have to know what kind of medications they're taking. Are they taking blood thinners? Then if they're taking a blood thinner, I probably can't be very aggressive with my soft tissue manipulation because they're going to bruise and bleed. So, great question. Any other questions? All right. Back to what I kind of do. So, chiropractor in Wausau. I am more in a sports-oriented clinic, but that does not mean I just treat athletes. Unfortunately, and this was kind of definitely eye-opening for me too, I graduated high school, knew I wanted to work somewhere in the medical field, wasn't huge into sports, I was a hockey soccer player, and wanted to work with athletes, which I'm fortunate I get to, but that's not everything. So in healthcare, it is very, very hard to narrow your scope of practice to just one specific thing. As you grow, as you get your reputation out, that's fine, but you also start here getting work in. Who wants to take a guess at the oldest patient we currently have today? Go ahead. 90? Anybody else?
94.
94? 93. Close.
Oh, I don't know.
Who wants to take a guess at the youngest patient I have ever treated?
Newborn.
Grab him and then.
How old?
Like, I don't know, like a week old.
Week old.
I'm not
Anybody else?
Just do it.
Yeah.
I can't.
2 months? Not bad. 17 days is the youngest patient I have treated.
What was wrong with her? Or
During birth, she had kind of a more traumatic birth, and she was very locked up, crying a lot, wasn't latching on her mother. So for infants, it's a lot of palpation and seeing what's tight and restricted, and knowing the nervous system, and knowing that if I'm working in the low back innervates the digestive system, it innervates all the nerves in our lower body. If I'm doing with the upper back, that's also some of the digestive tract, headaches, cranial nerves, that kind of thing. So it's knowing the nervous system, knowing what joints could be locked up because of that, and just working through the soft tissues, because birth is extremely traumatic to both mother and infant. Just think of an infant being in a ball for 9 months. They're going to be pretty tight. So that was a fun case to work on, very tiny. So other things I do. I not only do I do a lot of joint adjustments, manipulations, that kind of thing, I also specialize in soft tissue, mainly because I work with athletes. So majority of athletic injuries are soft tissue injuries, plus with other patients like grandma or my infants, or when it just comes to holding adjustments in joint manipulation, working on that soft tissue really does help. Not only helps the adjustment go smoother, but helps hold as well. We also at the clinic, we do a lot of functional, so I'll have people squat, I will have them run, do more biomechanics, which is kind of fun for athletes, as well as we have laser therapy, which is a good adjunct as modality, kind of like physical therapy, just to speed up the healing process and reduce pain. So that's kind of just an adjunct that we have. Any questions with that?
Did you talk about what the different, what's Graston?
Oh, I'm gonna get there.
Oh, you're getting there.
Yeah,
Oh, yeah, that's
you
right.
ran ahead.
Sorry.
You're good. So, that's just kind of what I do. In general, there are many different chiropractic techniques. I did not know this going to school, so this is very eye-opening to me. Here's just kind of a general list of different techniques, which that means that me and how I practice can be completely different from the chiropractor down the road. They be more of they have more of a gentle approach, or they function more with pediatrics, that kind of thing. So there's a huge span of techniques. My techniques are the ones in bold for the most part. So these top 3 are more of our manual adjustments. So this here is an actual flexion distraction table. So it's really nice to gap the joints, especially for low back pain. Thompson is just diversified. Those are just manual, your adjustments, your popping, cracking, that kind of thing that you're known for. Activator, or instrument assisted, is this little guy right here. So this is what I use on a lot of older patients. So because there's a lot of degeneration, a lot of bone growth, I'll also use it on children because it's very specific. I can change to exactly what force I want. So it's very easy to keep the same, keep it light, keep it gentle, that kind of thing. Active release, or ART, is a soft tissue technique that we use with our hands. So it specifically aims at certain muscle groups to lengthen and then shorten and then lengthen to break down scar tissue, help with neuromuscular plasticity, that kind of thing. Graston. So, anyone here heard of Graston before?
Every one of you, raise your hand.
Yeah, who was it that did it?
Amber, right?
Amber from the Bone and Joint came in.
Yeah. So this is, both ART and Graston are not just chiropractic techniques. They're used by athletic trainers, they're used by PTs, even some DOs will use them. But I can have Liz vouch for me here. How fun is Graston?
Not very fun.
So Graston is a soft tissue technique with metal tools. So as easy as those tools look, I can guarantee they are not very fun. But basically, I'm able to use the tool to work through the soft tissue to break down a lot of scar tissue and adhesions to, one, the scar tissue and adhesions could be causing pain itself, or they could be restricting mobility, and that's what's causing the pain, or it could be a combination of both, which most times it's a combination of both. But the tools are great to get a little bit deeper. Chronic hamstring strains, they're fantastic. Working in the hips a little bit, as well as I do see a lot of CrossFit athletes that like to destroy their bodies day in and day out, which you just can't keep up with some of the scar tissue that they build. So that's great for that. Anybody have questions with that? Okay. The only other one that I really have is kinesia. Oh, go ahead.
What's your output on inversion tables?
I love them, as long as they're done correctly. So would I recommend them to grandma who's sitting at home by herself? Probably not. But so this table is built on the same concept. So it's basically just sit there, gap, and open up the joints, bring in more blood flow to the area. So fantastic.
Do you get to choose which techniques you like more than
You do. So depending on the school that you want, each school has their own core techniques. And then from there, you can take different electives. So these were the techniques that I liked, that I thought best suited myself and how I wanted to treat patients. So that's what I specialized in. Next question. Anybody else? Okay. Okay, last but not least, the only other thing that, technique-wise that I use a lot in the office is K-tape. Has anyone ever had kinesio tape done before? Why did you have kinesio tape? Knee? Same thing? Hip? Back here?
I used to walk on my tippy toes, so.
Ah, so on the back of the leg or the front of your leg?
Front.
Front of your leg? Anybody else? Yeah? Shin splints, that's a great one. So K-tape. Honestly, it's kind of a Band-Aid. It's more of just a help so you don't destroy everything that we do out of the office, and that's from PTs, physical therapy. Yeah.
That's why you're talking about like this.
Yeah, that stuff, exactly. So it's kind of a Band-Aid, but it does great work. So especially for athletes that we want to get you back in the game as fast as possible, it's really, really good for that. Okay. Any other questions before I go on to one on stuff? No? Okay. Let's see where I am here. Who wants to take a stab at the #1 condition I see in my office? Or what is the #1 reason why people come see me? Go ahead.